I was on Boles Simpson. There were lots of the part of the plan I like. The reason people like me didn't support it is because it didn't address the problem, and the problem is health care. I worry that we're giving the country a false sense of security if we put out a fiscal plan that addresses everything but the primary issue, which is the primary driver of our debt. And the primary driver of our debt are these health care programs. You cannot structurally address the debt crisis if you don't address health care entitlements. And so not only did it ignore Medicare and Medicaid, I don't think it was the intention, but it was the consequence of Boles Simpson will to be accelerating Obamacare. So what that commission ends up doing, in my opinion, with respect to health care is more harm than good, more harm than doing nothing, because it will accelerate the imposition of Obamacare. If you take away the tax exclusion for individuals, we believe that more and more employers will dump their people into the health exchange and have subsidies go up far more than we are estimating today. If you take away the tax exclusion, that will just exacerbate that effect. And so we believe that the Boles Simpson will make it worse because it will accelerate Obamacare, increase exchange subsidies, driving up the deficit. I got a letter from the CBO 2 or 3 months ago saying that they, under more realistic assumptions, they believe that the president's health care law will exacerbate the deficit and the debt, will actually add to it under more realistic assumptions that they believe are more likely to occur. And then it didn't do anything to address Medicare or Medicaid. You got to remember the president's health care law increased Medicaid. It added a third to the eligibility standards. And it didn't really do anything fundamentally to fix Medicare. And I don't see the IPAB as a fundamental fix to Medicare. I think that's just more of shared scarcity. I think it's just price controlling. And price controls don't work. We did that. The 97 agreement was a good bipartisan agreement, but it was basically a Medicare price control agreement. And what happened? Congress, in 2 successive agreements, BIPA and BBRA, pulled back those savings, restored those savings, except for the SGR. And then we just patch that every single year. And so I don't think those things hold and stand. And so what was the lesson that was taken out of that? What the president's law does? It says, well, let's do more price controls like that, but just take it out of the hands of Congress and have a board do it so that it can withstand political scrutiny and just do it. That, to me, is not the path to take, and that is why people like me didn't support Boles Simpson.
Could I ask a quick question?
Yeah, sure.
Does that mean that, in your view, no compromise is going to work that does not dismantle health care reform?
No compromises. This is why I think 2012 is going to be the ultimate decider of these things. There are other things that can be done to make improvements, and that's what I think this debt limit debate is about. On other areas of government spending, in both the discretionary and the mandatory side, there are a lot of things we can do to save money and to put controls on debt and spending to commit us to getting spending down. But I don't think you can fundamentally fix this problem unless you fundamentally fix health care. And that is where we have a gulf that separates us. And that gulf, I think, will be largely determined, the outcome of which will be determined in 2012, in my opinion. This is what it is.
And what's interesting about your proposal, it not only lowers the rate, but it doesn't pay for it by increasing taxes on saving and investment.
That's right.
And that is unique about the Ryan program, and I want to commend you
House
for that.
Republican program.
The House Republican program with some bipartisan support, and we commend you for that. Secondly, I'm going to continue to give you the Man in the Arena so long as you are in the Arena Award. Join us all in thanking Paul Ryan.
Thanks,
for
Mark.
being with us.
Appreciate it. Thank you very much.